Hello students. In a previous lecture we have seen the cholinergic system. Now in this video we are going to talk about the cholinomimetic drugs, cholinergic drugs and parasympathetic drugs. Okay, the all these are the same. This is a classification of cholinergic system. Cholinergic drugs are classified into two, whether they are acting directly specific, that is cholinergic agonist, or if it is acting indirectly, they are known as anticholinesterase. Okay, so the cholinergic agonist drugs are classified into two, that is your choline esters or some alkaloid. We will read it brief in further lecture. The anticholinesterase, which is indirectly acting drugs, they are of reversible and irreversible. Reversible drugs can be of carbamates, acridine, physostigmine, neostigmine, adrophonium, or many more. And the acridine is the tacrine. In a further lecture, we will describe all the drugs individually. Now let's start with the physiological action. The acetylcholine act on both the receptors, muscarinic as well as to the nicotinic receptor. We will see about the muscarinic action. On a heart, the acetylcholine depresses the SA node and reduces the heart rate, and because of that it reduces the force of contraction. Keep in mind that in heart all the functions are depressed, and blood organs while other organs the action is increased. You will see in a further lecture. If you see on the blood vessels, it got contracted, the dilation of blood vessels, which decreases the blood pressure. On the smooth muscles, we will see the acetylcholine increases the tone of non-vascular smooth muscles, and on the gastrointestinal tract, the tone and peristalsis enhance the sphincters and also relaxes it. That your propulsions of intestinal content. On a urinary bladder, the structure contracts and the sphincters relax. On the bronchial smooth muscles, where the patient got a bronchoconstrictions. On next organ is the secretory gland. In that the secretion of all the glands got increased, like the salivary, lacrimal, nasopharyngeal, trachobronchial, gastric and intestinal secretions got increased. On the eye, the acetylcholine constricts the pupil and causes a masses by contracting the circular muscles of the iris and causes the drainage of aqueous humor. The spasm of accumulation to the ciliary muscle contraction and causes a ciliary muscle contraction. This is an adverse drug reaction of the acetylcholine. Further, we see a nicotinic action on the neuromuscular junction. The neuromuscular junction contract the skeletal muscles, and if it get prolonged, it causes a paralysis to the patient. The autonomic ganglia stimulate the sympathetic and the parasympathetic ganglia and the adrenal medulla. It will see the action on the central nervous system. Acetylcholine does not cross the blood-brain barrier, hence it has no effect on the central nervous system. Moving further to the pharmacokinetic parameters, acetylcholine if is given orally, it rapidly destroys the gut, and if it is given as an IV, it rapidly metabolized by the pseudocholine esterase in the plasma and by true choline esterase at the site of action. So occasionally it can be given as 1% eye drop to produce masses. Uh, Further, we will discuss one by one a cholinergic drug classification. First is the ester of choline. The example is carbachol and bethanchol. So these ester of choline are effective orally and resistance to both choline esterase, and due to that their duration of action is also high. They are used in hypertonia of bladder, hypertonia of GI smooth muscle, post-operative paralytic ileus, or urinary retention. There are some adverse effects which has to be monitored while taking these drugs. First is the diarrhea, salivation, sweating, bradycardia, hypotension, bronchospasm, and syncope. Second class is a cholinergic alkaloid. The first class of drug is the pilocarpine. It is obtained from the Pilocarpus microphyllus, and it is a tertiary amine which crosses the blood-brain barrier and causes the central nervous effect. If we see the physiological action, the muscarinic actions are more potent, and the action on the eyes are very important because it's a constriction of the pupil, and it causes a decrease in the intraocular pressure by drainage of aqueous humor, and also causes a spasm of accommodation by contracting the ciliary muscles. It also increases the sweat. That condition is known as diaphoretic, and also increases the salivary secretion. The condition is a salagogue. It also decreases the blood pressure in the therapeutic doses and increases the blood pressure and tachycardia in higher doses. Here are some uses of cholinergic alkaloid, which we are reading about the pilocarpine. The uses, it can be used in a glaucoma as a eye drop or accusert, used alternatively with the mydriatic to break the adhesion between the iris and the lenses, and it is also used in the dryness of the mouth while radiation of head and neck. It is mostly used in a Sjögren's syndrome where the patient got a dryness of mouth and lack of tears. Some adverse effect of pilocarpine are like if we are using as an eye drop, it may cause the burning sensation to the eye and painful spasm of accommodation, corneal edema, or if we are using in a long term, it can cause a retinal detachment. If it is we are using as a systemic use topically, it causes a salivation, sweating, bradycardia, diarrhea, and bronchus. It can occur in some of the cases. Now, the second class of cholinergic drugs are indirectly acting cholinergic drugs, in which we are reading about the anticholine esterase. These anticholine esterase are the drugs which inhibit the choline esterase. By inhibit the choline esterase, it are acting as a cholinergic system. So basically, the anticholine esterase are either ester of carbic acid, which is a carbamate, or the derivative of phosphoric acid, or known as organophosphorus acid. The basic mode of action of anticholine esterase is they are structurally similar to the acetylcholine, so they will bind to the acetylcholine esterase and inactivate them. Which will prevent the hydrolysis of acetylcholine and excessive accumulation of the acetylcholine. Thus, it will increase the activity of the cholinergic system, mostly your parasympathetic action. So basically, the acetylcholine esterase contains both the site anionic as well as the esteatic. So the acetylcholine and reversible anticholine esterase, except the endophorin, bind to both the anionic as well as the esteric site. Endophorin binds to the anionic site only. It will not bind to the esteric site. Its binding is very quickly and reversibly. That's why it is a very short acting drug. And next is your organophosphorus compounds, which bind only to the esteric site, but the enzyme gets phosphorylated by the covalent bond, hence it is more stable as compared to the androphonium bind. Next drug is a physostigmine of the indirectly acting drug. Physostigmine is obtained from the Physostigma venenosum, and it is a highly lipid soluble, and it is a tertiary ammonium compound and hence a better penetration into the tissues and also crosses the blood-brain barrier. It is mostly uses in the glaucoma and atropine and tricyclic antidepressant poisoning. Next drug most commonly used is the neostigmine. It is a synthetic quaternary ammonium compound, and it is poorly absorbed from the gut and does not cross the blood-brain barrier. So there is a difference between a physostigmine and neostigmine. That physostigmine can cross the blood-brain barrier, but the neostigmine cannot cross the blood-brain barrier. It can be used in a myasthenia gravis, post-operative ileus, atony of the urinary bladder. There, I have shown the basic classification, basic difference of the physostigmine and the neostigmine, where it is being obtained, where the what are the absorption, what is the chemistry, what is the absorption. We have already seen tissue penetration, or what are the primary use and use in poisoning. So physostigmines are used in atropine poisoning, and neostigmine is used in Curie poisoning. So next is the androphonium. We have seen that androphonium binds only on the anionic side, and it is a tertiary ammonium compound, so it is very rapid because of that of short duration, that is of 10 to 20 minutes, and it is used on the diagnosis of myasthenia gravis. Androphonium, if it is taken intravenously, it can be used for a snake bite and a Curie poisoning. We can use a androphonium test which differentiate the myasthenia crisis from the cholinergic crisis on administering the androphonium 2 mg IV. If the symptom worsens the cholinergic crisis, we will give atropine. If the symptoms improve in myasthenia crisis, we will give anticholinesterase. Okay. Moving further, next drug is rivastigmine and pyridostigmine. Rivastigmine, rivastigmine is long-acting carbamate and selectively binds to the anticholinesterase in the brain and uses for the mild to severe, mild to moderate Alzheimer condition. Pyridostigmine are used in a myasthenia gravis. So most of the organophosphorus poisoning, the symptoms are vomiting, abdominal cramps, diarrhea, myoses, increased sweating, increased salivation, increased tracheal and bronchial secretion, hypotension, muscular twitching, weakness, and confusions. These all are the symptoms of organophosphorus poisoning. For the treatment, first of all, the if the poisoning through the skin, remove the clothing and wash the skin with the soap and water. If consumed orally, immediately give a gastric lavage, and the patient should be put in a prone position to avoid the aspiration of the secretion. And by the time, maintain the blood pressure and the BP airways. The drug of choice for the organophosphorus poisoning is atropine, which is given IV 2 mg every 10 minutes till the pupil dilates. Cholinesterase reactivators like pralidoxin, abidoxin, and diacetyl monoxin can be used for the treatment of organophosphorus poisoning. So that's all for this. Thank you.